Hi, my name is Shia Ritchie, and I actually do have a story of when collaboration and transport was required, and I was actually the one to help facilitate that. So during a planned home birth, I was at a birth, and during the active phase of labor, the client had like prolonged fetal heart rate decels, and we tried maternal position changes and like other interventions, and nothing was really working. So like everyone was really concerned, and the midwife recommended a transfer to the hospital for further evaluation and possibly other interventions that we could not provide. So I actually contacted EMS. That's something like she and I had trained on, and I was the only assist at the time. This was a very like unremarkable pregnancy, and then this just happens. It was just me and the midwife there. So I communicated the client's condition, gestational age, labor history, the fetal heart rate concerns, and like what they had been for the past few minutes, the interventions that we had already tried, the position changes, and while we waited for the EMS, I continued to help monitor the client with the midwife and the fetus, and provided reassurance. That was sort of like my job, was to provide reassurance to her and to her husband. And I stayed behind while the midwife went with her to, well, she, once the EMS arrived and they'd taken her, she had went with her to the hospital. And she called me and was like communicating directly like what the receiving nurse and the like OB provider were doing, and sort of like reiterating to me what events had led to the transport. And so like as far as like reflecting on that situation, I did feel concerned because the fetal heart rate pattern was indicating that the baby might not be tolerating labor well. It had been several hours of labor. And also, this was like my very first time in a situation like this. So I did feel like that sense of urgency because I wanted to ensure that the client was, first of all, okay, that the baby was okay, and that they understood why like the transfer was necessary without like increasing her anxiety. And thankfully she was like very receptive and, in my opinion, calm about what was going on. And obviously EMS arrived really really quickly, I think like within 10 minutes. So my confidence kind of like went up because what I was doing in tandem with my preceptor, it worked. Like obviously it was going to work, but like it was just nice to see that it like we got it done, you know. And I also appreciated like being able to advocate for the client, advocate for the baby, advocate for my midwife too, like making sure that she was doing her job and telling the client like, this is what we tried, this is what it's time to do now, but like also reassuring to the client like this is what you do in this situation. And our midwife, her name is Katie, she's doing sorry, not Katie, Christy. She's doing exactly what she's supposed to be doing, and everything's gonna work out perfectly. Katie's my current preceptor, Christy was my last one. So I think like the aspects of the collaboration went well. Obviously I wasn't at the hospital, but when Christy had called me, she was describing to me that like, okay, Obi was very communicative. She also reassured me like, you did such a good job communicating everything to the EMS. I was able to provide like important client information that they needed, statistics, all that good stuff. And I also felt like the client was very heavily involved in the decision making process, which I think helped maintain like her trust in us because this was all very unexpected. And I know she had definitely wanted a home birth, but a lot of times things change. and her effort was like valiant. Like she fought for hours in labor. We just tried a lot of things that weren't really working, and the time was ticking to a point where it got concerning. That the D cells kept steeping so low, like baby would come back a little bit lower than baseline and then steep again, which is very concerning. Anyway, back to the collaborative efforts with my midwife and the OB. She was telling me that like the handoff was very very easy. The receiving team understood the situation, and then they continued care without like any delays or like confusion. I think one area that could have gone better was like maybe the organization of the like information in the handoff. And I guess this is me thinking of a way where in a high intensity situation forms were not filled out, promptly. They had to be filled out there. So like I think like in a stressful situation it can be easy to provide like too much information or leave out important details. So I'm thinking like retroactively, if there was anything that I could possibly change, or not change, because I'm sure Chrissy did everything right. If there was anything I would focus on very, very well, it would be making sure that all the details are explicit and thorough and charted, obviously. I think there was also an important opportunity to clarify roles, especially with like EMS, so that everyone understood like who was responsible for what and who to direct information to. Because I feel like EMS was coming to me for several things, and I was like, oh, I'm just the student here. You'd have to speak to the midwife, which is like the role that I was told to be in those EMS situations, is like direct the information to the midwife. She's the professional. One thing that was done super well was just what my role was meant to be. I did my role well. I was told what my role was supposed to be, and I like stayed right within the narrow boundaries of my role. And I respect that. I can maintain those boundaries. So yeah, this experience definitely demonstrated an importance of interprofessional collaboration in midwifery practice. A midwife may provide like continuous, individualized care, which is also, I think, a few of those chores, or not chores, but like job, that few of those assignments should also be given to the student, so that the midwife doesn't have an intense load. I think especially because we were like, it was a dual team. It was literally just me and her. It was great that I was able to take off some of her load so that she could focus on frequent monitoring of the midwife, of the mother of the baby, assuring the parent, and also I think luckily retrospectively there was no other baby there, so we didn't have to worry about who was going to take care of the other person in the family. Yeah, all that to say, that was my experience, and it was a positive experience. So when it happens again, I will definitely have the confidence to execute it, probably even better, which could only be close to perfect. Okay, thank you.